Here are 10 critical tips that you cannot miss following tooth removal. Now, these tips are actually applicable if you had a wisdom tooth removal or removal of any other tooth, and even they're applicable to minor surgeries in the mouth. Many of you requested this video, so watch it until the end because the last 3 tips are not really talked about that much, but they're very, very critical. Firstly, we will address swelling. How can you actually reduce the swelling following wisdom tooth removal? Well, you can actually use cold application. So that's best to be in the form of ice wrapped in a clean cloth, and you apply it externally to the site of swelling. And the reason cold helps with swelling is because it actually constricts the blood vessels and thereby reducing the blood flow to the area and hence reducing the swelling in the region. And it's best to do this in alternative application, meaning for 20 minutes you apply cold, and then for another 20 minutes you remove the cold, and then you can apply it again. Now we will address pain. Normally, following the tooth removal, it's very, very normal to have mild swelling and also mild pain because there was trauma to the area. There's a minor surgical procedure that was done, so it's completely natural to have that. And usually following tooth removal, the attending oral surgeon or dentist will prescribe you with mild painkillers like Panadol and ibuprofen. Panadol, which is the brand name for paracetamol. Sometimes it's sold as Tylenol, Adol. It has many other names depending on which country you're watching from. And with regard to ibuprofen, it's very important to discuss with your attending doctor if you have any conditions such as any allergies, or if you have peptic ulcers or stomach ulcers, or if you're pregnant, because all of these things can massively influence the choice of painkiller given to you. Make sure you do not overtake these painkillers and only take them on an as needed basis. And also make sure to take the prescribed medication by your attending doctor. Now I will address how to reduce the risk of bleeding and hemorrhage. Hemorrhage is simply the excessive bleeding, and you do not want to have that because you may actually end up in emergency room. So the first thing is very simple, but it's very important, and that is you avoid spitting. Why? Because when you spit, there's actually something called as a blood clot that's formed by our body at the extraction site. And this initiates the healing. Now, whenever you spit, that blood clot dislodges and leaves the wound open. It will bleed again, and also it will increase the likelihood of something very disastrous called dry socket. This is an extremely painful condition. You do not want to have a dry socket. Avoid vigorous exercise or strenuous exercise and activity. Listen, the recovery period is not the time for you to set a new squat PR or to wrestle with a wild bear. This is the time for you to rest and allow the best circumstances and environment for the wound to heal. Avoid using a straw. Now, this is very simple, yet ignored by many people who had a tooth removal. Straw sucking motion may actually also dislodge the blood clot, causing the same issues that may happen when you spit. Now, in an event bleeding does occur, what can you do? You can apply pressure, ideally using a sterile gauze, to the extraction site. It's a local measure to help stop the bleeding, and also you sit upright to reduce the blood flow to the extraction site. Now, if these local measures do not work out and there's still bleeding, you should immediately contact the healthcare center where you had the extraction. It's very important to avoid hot foods and hot drinks because these may actually also lead to the dislodgement of that blood clot, reinitiating the bleeding again and causing a higher likelihood of dry socket. So you do not want this to happen. It's best to avoid any foods or smoothies that contain seeds, granules, or any small particles that may get inadvertently dislodged into the extraction site. Now, your body and the extraction site, they do not really know what just got dislodged into that area. And what would happen, your body treats it as a foreign body, the seed or the granule or whatever, and it will actually initiate a foreign body reaction. Now, this can cause a lot of pain, discomfort, even swelling in the area, and will disrupt the healing process. So just avoid these kind of foods during the recovery period. Avoid chewing or eating on the side of the face where you had the extraction done, because this will cause a lot of pain, may increase the likelihood for bleeding and dislodgement of the blood. You should definitely avoid smoking. Smoking can be completely disastrous to the healing process, because most of the stuff that you'd smoke contain toxins and other very dangerous substances, but most smoking devices and cigarettes, they actually contain nicotine, and nicotine acts as a vasoconstrictor. So it constricts the blood vessels in a sense that there will be less blood flow to the extraction side and much slower healing with a very high likelihood of an infection. Now, normally I like to give the post-extraction instructions verbally and in written form as well. Some centers do this, some doctors don't. Bonus tip for those who stayed until this part of the video: avoid also eating spicy foods and foods that contain taste, such as lemons and oranges, etc. Because not only these may irritate many parts in the inside of your mouth, but they also can really irritate the extraction site. So these are the 10 critical tips. I hope this video was very beneficial to you. Share it with your friends and relatives who may have had or are going to have a wisdom tooth removal or any tooth removal in the very near term. And I hope you have a great day.